Death rates among the Black community from the coronavirus are 92 deaths per 100,000, more than twice the rates of white people at 45 per 100,000. And here in Alabama, African Americans make up about 42% of the confirmed COVID-19 cases. The CDC says residential segregation, food deserts, and higher rates of workers in essential businesses can be factors in this disparity. So testing options are more important now than ever. The Madison County chapter of the NAACP has been pushing this message.
A large amount of black people have, suffer with diabetes, high blood pressure, asthma, and when you combine that with coronavirus, then you have a double impact.
Burnett says some members have been tested at Huntsville Hospital mobile units. The Huntsville Hospital system has had 20 remote testing sites so far.